As we continue through the coronavirus pandemic, health experts have been talking about a possible second wave hitting the U.S. later this year, and some wonder if it could be even worse. Just moments ago, I spoke with St. Louis physician Dr. Dan O'Brien about what we could expect. Dr. Bryan, thanks for joining us tonight. There's been a lot of talk lately about a second wave of the coronavirus later this year. Why is that, and what are the chances of that happening?
Yeah, it's really a great question. What we've seen with the flu and the cold, obviously these things can kind of occur, it continues to occur because right now we don't know, we have enough data to figure out exactly kind of what's going on. And as we kind of look back at the data, we can certainly figure out that a second wave potentially could hit, just like we see with colds and flus.
What do you think that a second wave would look like? Could it be even worse than this first wave that we're going through right now?
I think based on the data, it may not be as bad. What our public health officials are doing is certainly crucial in regards to what they've done to prepare everybody. So I think what we've learned so far, and as much as we've learned from the data, I think this second virus is not going to be as bad.
Well, that's good news. But with businesses starting to reopen now, if there is a second wave later, is there a chance that those businesses would have to close down again to stop the spread?
Yes, that's certainly a possibility. I think that's why it's so crucial that this is done the right way. And that really, as we're looking at data, as we're collecting data, that we're on the right side of science, especially to be able to educate our public health officials on what to do next.
I want to ask you, what have we learned from this first wave that we could use if a second wave does hit later this year?
Sure, just the importance of social distancing. How has this worked? How has quarantine worked? What decisions need to be made as far as public health officials? And even when looking at medical supplies and masks and ventilators, how much we need that as we kind of prepare for the future.
Are there things that we can do right now to prepare for that second wave?
Sure. I think from a clinician standpoint, keeping your immune system up, right? Practicing social distancing, following the appropriate guidelines are some of the things that we can do to keep ourselves safe and healthy.
Looking ahead, how do you see the coronavirus affecting us?
Sure. Well, right now we're about 12 to 18 months away from a vaccine, because really what's important is we have to be able to get to phase 3 trials, which kind of look at the safety and efficacy of a particular vaccine, including samples within a large population. So I think in the meantime, we have to be very cautious in regards to keeping with the guidelines of social distancing and wearing masks and being just kind of smart on how we approach interacting with society again.
And what is your opinion? Do you think that we could actually see a vaccine by later this year?
Yes, I think realistically within 12 to max 18 months. We have great research and scientists here in this country, and I think they're working very hard, not only on the diagnostic side, but also with a vaccine, like you mentioned.
What about the healthcare industry? Do you think it is prepared for a second wave?
Yes, I think we've learned so much in regards to this first wave when looking at medical supplies, ventilators, what all we need to be successful to overcome this. And I think we're going to be more prepared than ever.
And that was St. Louis physician Dr. Dan O'Brien.